Hello students, this is Professor Baldwin. This discussion will be on fluid and electrolytes, which you can find in chapter 42 of the Potter and Perry textbook. This recording is for topic 6, which has 4 chapters, so this will be the first of 4 different recordings for this topic. You have 8 objectives that go along with fluid and electrolytes. You can create a study guide with these objectives by turning them into questions and then fill in the answers with information found in your resources. Remember that there are speaker's notes in these PowerPoints with more information. You are responsible for anything in the speaker's notes as well as in the PowerPoint. You could see exam questions from that material. So be sure that you read that and also notice any reference to materials from the Potter and Perry textbook, such as diagrams, boxes, tables, that kind of thing. If it's mentioned in the speaker's notes, you need to go and review that material in your textbook because you are responsible for that as well. The fluid balance of the human body is critical for homeostasis. The body's fluid is balanced by intake and output, or in other words, what fluids go into the body and then what fluids come out. The body fluids are either found in intra or extracellular spaces, with extracellular being the interstitial and intravascular spaces as well. So to maintain homeostasis, the body fluid compartments must have balances in the amount and location of fluids and electrolytes, with effective movement through the capillary and cell membranes. If body systems are functioning correctly, fluid will move through the intra and extracellular compartments by osmosis. Fluid homeostasis involves 3 processes: fluid intake and absorption, fluid distribution, and fluid output. So to maintain fluid balance, fluid intake must equal fluid output. This is an important regulator of fluid intake when plasma osmolality increases or the blood volume decreases. The thirst control mechanism is located within the hypothalamus in the brain. Osmoreceptors continually monitor plasma osmolality. When it increases, they cause thirst by stimulating neurons in the hypothalamus. A lot of this information was covered in your prerequisite classes, anatomy, physiology, and pathophysiology. So we don't go into a lot of review on that information. Remember, if you need a refresher on any of that, your Potter and Perry is a good resource, so you can use that to go back and review this information. All right, this PowerPoint contains a case study. We're not going to go into the details of the case study, but it's a good way to apply the information that we're learning into the care of a patient. So if you want to, on your own, review the information about the patient and the nursing care, and look at the questions in the speaker's notes that are asking you to think about certain aspects of nursing care of this patient. I won't be going over the questions. There's another one located in this PowerPoint, so you can review that on your own. Fluid output normally occurs through 4 organs: the skin, lungs, GI tract, and the kidneys. The kidneys are the major regulator of fluid output because they respond to the hormones that influence urine production, and these are the antidiuretic hormone, aldosterone, and atrial natriuretic peptide. So there are 4 things to consider for fluid balance and homeostasis in the body. Fluid intake and fluid output, which need to equal. The distribution of fluid in the intra and extracellular spaces, which includes the vascular and interstitial spaces, and then appropriate hormonal influences from the hormones that influence urine production, ADH, the RAA mechanism, and ANP. The average adult should take in approximately 2,300 milliliters of fluid daily. Fluid output occurs through the kidneys, skin, lungs, and the GI tract. There are 2 ways that fluid is lost from the body. One is the sensible fluid loss, and this is going to be fluid that's lost that we can measure, that we can see and actually measure the amount lost, such as urine. Insensible loss refers to fluid that can't be measured. For instance, perspiration would be a type of insensible fluid loss. Clients can experience fluid loss from disease processes, medications, or other situations that interrupt fluid intake and output. An example of this is vomiting and diarrhea, which increases fluid loss and creates excess fluid loss from the body. And this often occurs without increased fluid intake, which then leads to clinical dehydration. Fluid imbalances can be the result of volume imbalances, osmolality imbalances, or an imbalance of both. In an osmolality imbalance, body fluids become hyper or hypotonic, and this causes osmotic shifts of water across the cell membranes. 3 processes are involved in electrolyte homeostasis: electrolyte intake and absorption, electrolyte distribution, and electrolyte output. Electrolyte intake comes from foods and beverages. Electrolyte output occurs through normal excretion in urine, feces, sweat, vomiting, drainage tubes, and fistulas. When electrolyte output increases, electrolyte intake must increase to maintain electrolyte balance. If electrolyte output decreases, as with oliguria or decreased urination, electrolyte intake must also decrease to maintain balance. In reviewing electrolyte imbalances, we're going to discuss potassium, calcium, and magnesium. Sodium isn't included here because serum sodium imbalances are the osmolality imbalances discussed previously. I won't go over these questions. You have 2 in this PowerPoint, but please review those on your own. Serum potassium controls cardiac rate and rhythm, the conduction of nerve impulses, skeletal muscle contraction. Small changes in the potassium level have a profound effect on the body and are poorly tolerated. The kidneys eliminate approximately 90% of the body's potassium. Please review the bullet points in the speaker's notes. These are nursing diagnoses that could apply to your client with hyperkalemia. In the speaker's notes on this slide, you'll find potential nursing diagnoses for clients experiencing hypokalemia. Please review the information for both hyper and hypokalemia and know what could potentially cause a client to have potassium imbalance, and also understand what you could expect to assess in these individuals. Calcium is necessary for muscle contraction because it influences the excitability of nerves and muscle cells. Please review the information on this slide, which covers hypercalcemia, and the following slide, which covers hypocalcemia. Review the potential causes of calcium imbalance and what you would anticipate assessing in clients who are experiencing these electrolyte imbalances. Also in the speaker's notes, you'll see potential nursing diagnosis for clients experiencing calcium imbalances. Magnesium is important because it influences the function of neuromuscular junction and is a cofactor for numerous enzymes. On this slide, you see causes of hypermagnesemia and also signs and symptoms the nurse would anticipate assessing in a client experiencing hypermagnesemia. Please review this information and also the information on the following slide, which provides information on the causes and also signs and symptoms of hypomagnesemia. So what is the nurse's role in providing care for a client with fluid and or electrolyte imbalance? The nurse needs to understand how to provide safe, optimal fluid therapy. The nurse also needs knowledge of risk factors for fluid imbalances in a variety of patients. The nurse should ask questions to determine if the client has existing risk factors for fluid and electrolyte imbalances. And the nurse needs to know how to perform a clinical assessment and what signs and symptoms to look for that would indicate these imbalances are occurring. The nurse uses the nursing process to assess and plan effective care for clients based on that individual's specific needs. Critical thinking is an important component of the nursing process, and using critical thinking will help the nurse to understand how fluid and electrolyte imbalances affect each specific patient individually and the patient's family, and assist the nurse in identifying appropriate nursing diagnoses and planning successful interventions. The first step of the nursing process is assessment. Without assessing the client to identify abnormals or problems or potential problems, then the nurse has nothing on which to base patient care. The nursing process section of your PowerPoints and your chapters in the Potter and Perry textbook always begin with the statement through the patient's eyes. Very important to remember that our assessment of clients is not just objective, but we also need the very important subjective assessment, which is obtaining information from the patient. Remember that your patient is the best source of information about themselves, and there is specific subjective information that only the patient can tell the nurse. There is some specific assessment data the nurse needs to obtain when doing a focused assessment for the client's fluid and electrolyte status. Older adults are at greater risk for fluid and electrolyte imbalances. A client's environment, diet, lifestyle, including modifiable risk factors such as alcohol intake and certain medications, can all play a part in the patient's fluid and electrolyte status. Also, additional factors in a client's medical history, their acute and chronic conditions, can cause fluid and electrolyte imbalances. When assessing a client, cluster related findings from the assessment data that could indicate fluid and electrolyte imbalances. Consider the assessment findings of the client that are shown on this slide and try to identify which ones would indicate fluid and/or electrolyte changes or imbalances. Consider the lab results on this slide, which are also assessment findings, and try to determine what would be the appropriate nursing diagnoses for this patient. Obtaining daily weights is an important indicator of fluid status and is also the best way to monitor a patient's fluid volume status. Each kilogram, which is equal to 2.2 pounds of weight gained or lost overnight, is equal to 1 liter of fluid either retained or lost. These fluid gains or losses indicate changes in the amount of total body fluid. To effectively monitor a patient's fluid volume status, daily weights should be obtained at the same time every morning, using the same scales, with the client wearing the same clothes and before they've had breakfast. Always follow facility policy for documenting a client's fluid intake and output. Intake is considered anything liquid that goes into the patient's body. So some examples of that would be IV fluids, liquid medications, anything they drink, or foods that will turn to liquid in the body during digestion, like gelatin or ice cream. Output is any liquid that comes out of the client. So for instance, urine, watery stool, diarrhea, vomitus, gastric suctioning fluids, and any drainage. Clients and caregivers can assist with keeping record of intake and output, but it's the nurse's responsibility to teach clients and their caregivers how to accurately measure and record intake and output. Some clients who are on fluid restriction need to be educated on how to monitor and limit the fluid that is obtained orally. And usually there's an order. If the patient is on a fluid restriction, the physician will place an order that indicates the maximum amount of fluid that that patient can have in a 24-hour period. This slide shows potential nursing diagnoses that can apply to a client experiencing fluid and or electrolyte imbalances. You can find nursing diagnoses in your Sparks and Taylor Nursing Diagnosis Handbook. After gathering and analyzing your assessment data for the client, determine if the client has an imbalance or is at risk for an imbalance, and then determine which of these nursing diagnoses appropriately applies to that client. So consider the patient information provided in this case study slide, and then look at the question in the speaker's notes and see if you can determine what the correct answer is. The third step of the nursing process is planning. So once assessment data has been gathered and analyzed, and nursing diagnoses have been assigned for the patient and prioritized, the next step is for the nurse to work with the client and any caregivers to plan effective care to meet the client's needs. Every patient's different, and in order to provide effective nursing care, the plan should be client-centered to meet that individual's specific needs. If the patient's medical condition isn't dealt with in a timely manner, any fluid and electrolyte imbalances will worsen. Especially, this is true in the elderly and in the very young or those who have chronic illness. When caring for clients in the hospital, if the client is in an unstable condition with fluid and or electrolyte imbalance, do not delegate that patient's care. They need close, consistent, careful monitoring. Once a patient's condition returns to stable, the nurse can delegate certain tasks to unlicensed assistive personnel, but it's the nurse's responsibility to make sure that any tasks delegated are within that unlicensed individual's scope of practice. Two things that could be delegated in this situation concerning a patient's fluid status are obtaining the daily weights and obtaining the patient's intake and output measurements. So in other words, the unlicensed assistive personnel could weigh the patient and document the daily weight in the patient record. They can also measure any patient intake and output and document those numbers in the patient's record. However, always remember that an unlicensed assistive personnel cannot assess a patient. It is not within the unlicensed person's scope of practice to form any type of assessment. They can obtain those numbers and record them, but they cannot assess and determine what the patient's needs are. That is the responsibility of the registered nurse. And when the patient is well enough to go home, their discharge plans may include collaboration with other services that will continue that patient's care and maintenance once they return home. Review the information on this case study slide and determine what interventions could be implemented for the client. The fourth step of the nursing process after assess, diagnose, and plan then is implementation. And in this stage of the nursing process, we're going to implement the interventions that were determined when the patient's plan of care was decided. Efforts for health promotion focus on educating the client and their caregivers. This education should include risk factors for fluid and electrolyte imbalances and ways to prevent those. Also, education needs to include the signs and symptoms that the client and caregivers need to be aware of. This is especially true in the very old and very young patients and in those with chronic conditions because these clients are more susceptible to fluid and electrolyte imbalances. Additionally, the nurse needs to educate clients and caregivers on what to do if fluid and electrolyte imbalances should occur. In the acute care setting, the nurse may administer medications and oral and IV fluids to replace fluid and electrolyte deficits or to maintain normal homeostasis as ordered by the provider. They may also assist with restricting fluid intake as part of therapy for clients experiencing fluid volume excesses when ordered by the provider. Prevention and treatment of extracellular volume deficit, hypernatremia, and electrolyte deficits are accomplished with enteral or parenteral administration of appropriate fluids. Enteral replacements is whenever fluids and electrolytes are replaced through the oral route, and this is appropriate as long as the patient is not so physiologically unstable that oral fluids cannot be replaced rapidly or are otherwise contraindicated. Nurses can assist clients in acute care settings who have fluid and or sodium restrictions per provider's orders. Fluids and electrolytes may be replaced through IV infusion of fluids directly into the veins rather than via the digestive system. Parenteral replacement of fluids and electrolytes includes parenteral nutrition, also IV fluids and electrolyte therapies, which would be crystalloids, and blood and blood components, which are colloids. These can be administered via peripheral IVs. Some patients may have central line catheters in which the IV catheter goes into the central circulatory system through the vena cava, and the tip of that catheter ends close to the right atrium of the heart. So whatever type of IV the patient has, the nurse needs to practice standard body fluid precautions when using these IVs for parenteral administration of fluids, and also practice IV site care when administering fluids to prevent contamination and potential infection of those areas. Parenteral nutrition can also be called total parenteral nutrition, or TPN, and this is an IV administration of a complex, highly concentrated solution containing nutrients and electrolytes, and this solution will be formulated to meet the client's specific nutritional needs. The goal of IV fluid administration is to correct or prevent fluid and electrolyte disturbances, to provide safe and appropriate therapy to patients who require IV fluid replacement. The nurse needs knowledge of the correct ordered solution. IV fluids are administered based on the provider's order. Please see Table 4211 in your Potter and Perry textbook, which provides information on intravenous solutions. An IV solution may be isotonic, hypotonic, or hypertonic. Isotonic solutions have the same effective osmolality as body fluids. Sodium-containing isotonic solutions, such as normal saline, are indicated for extracellular volume replacement to prevent or treat extracellular volume deficit. Hypotonic solutions have an effective osmolality less than body fluids, thus decreasing osmolality by diluting body fluids and moving water into the cells. Hypertonic solutions have an effective osmolality greater than body fluids. If they are hypertonic sodium-containing solutions, they increase osmolality rapidly and pull water out of the cells, causing them to shrivel. The decision to use a hypotonic or hypertonic solution is based on the patient's specific fluid and electrolyte imbalance. Additives such as potassium chloride are common in IV solutions. A healthcare provider's order is necessary if an IV is to have additives added. You should administer potassium carefully through the IV because hyperkalemia can cause fatal cardiac dysrhythmias. Under no circumstances should IV potassium be administered by an IV push, and that means with the potassium solution in a syringe that is pushed at one time as a bolus into the IV. The nurse needs to verify that the patient receiving potassium has adequate kidney function and urine output before administering an IV solution containing potassium. Devices for long-term use include central line catheters, such as the one that was illustrated in the previous slide, and implanted ports, which empty into a central vein. Remember that the term central applies to the location of the catheter tip, not the insertion site. In other words, central line where the tip is located is where the medicine will be delivered. Peripherally inserted central catheters or PICC lines, PICC lines, enter a peripheral arm vein and extend through the venous system to the superior vena cava where they terminate. Sometimes central lines are placed in the subclavian or jugular veins. Large volumes of fluid, parenteral nutrition and medications, or fluids that irritate veins can be administered through these types of IV lines. Proper care of central line insertion sites is critical for the prevention of catheter-related bloodstream infections, or CRBSIs. Also, another term for central line infections is CLABSI, CLABSI. And just like skin breakdown or falls in the hospital, central line infections are something that should never occur when nurses follow policy and procedure and provide care for those central lines as they were educated to without skipping any steps or implementing workarounds, then we can prevent those infections from occurring. The picture on this slide shows items that can be used to measure urinary output. So the clear canister in the front can be used to measure urine. If it's urine that's obtained in a bedpan that the patient's used, can be poured into this canister, or the patient's urinary Foley catheter collection chamber can be emptied into this container. It has milliliter measurements on the side, so once the urine's emptied into this canister, then the nurse can inspect and determine the ml amount of urine that to record for the patient's output. The other white containers can be placed on the commode. You would place these on the commode bowl and then put the seat down on top of these to hold them in place, and they can collect urine. And once the urine's collected, then the nurse can use the measurements you see on the containers to determine the urinary output. Whenever the nurse implements any interventions that are part of the patient's plan of care, they should always explain to the patient what is going to happen and also explain the reason for the intervention. In the case of a patient who's receiving electrolyte replacement, the nurse should explain to the client the reason that they're receiving the replacement therapy. Also, in the case of fluid imbalances, the nurse should explain the purpose and reasoning behind monitoring and maintaining balanced intake and output to prevent the patient from experiencing fluid volume imbalances. Clients, and especially older adults, often require continued replacement therapies whenever they return to their home or wherever it is that they live, or if they're going to a facility to recuperate and rehabilitate before going home. Medications can also alter fluid and electrolyte imbalances. So it's the nurse's responsibility to provide a thorough review and education of all therapies, and also to explain medications and how they can potentially alter fluid and electrolyte balances. Clients can also and should be instructed to consult their local pharmacist if they're wanting to try a new herbal or over-the-counter drug, and should be instructed to contact their provider about these and any other complications or concerns. The nurse is responsible for evaluating the client's fluid and electrolyte status after interventions have been implemented, and the purpose of this is to determine whether interventions have been effective. Always compare the current assessment findings with the previous patient's assessment findings. Are the improvements in the current assessment findings indicating imbalances? Compared with the baseline findings of the initial assessment, are those abnormal findings still present, or are they worsened? For patients with less acute alterations, evaluation likely occurs over a longer period of time. The nurse would evaluate for changes that will help improve the client's condition. The nurse would also want to ask questions to assess the client's ability and or willingness to comply with any interventions that are part of the plan of care to be implemented.